I'd like to talk about hypertension, high blood pressure, and just a few basic principles about hypertension. Hypertension can be a side effect of certain medications that increase norepinephrine, adrenaline, and that also increase dopamine and that cause vasoconstriction, that cause fluid retention, that affect electrolyte balance, sodium levels. There's various mechanisms by which a medication might lead to high blood pressure. First of all, it's very common, and many times the reason for the high blood pressure is unknown. We call that essential hypertension. A good percentage of people, especially people in middle age, and particularly smokers, people that don't exercise regularly, persons who are obese and who have other comorbid conditions, people that have a lot of stress and that don't follow up regularly with their physicians. What I'd like to really emphasize is that unless a person is in a hypertensive crisis, they're not going to have symptoms related to their high blood pressure. And this is something that I think patients frequently make comments to indicate that they don't understand that about high blood pressure. If you have a headache, if you're stressed out, if you're angry, if you're nervous, and you measure your blood pressure, it's likely going to be elevated for all of those reasons. The fight or flight response, sympathetic discharge, the very same chemicals, norepinephrine, dopamine, they can make you anxious, make your heart rate speed up. One of the symptoms of a panic attack is a pounding chest, and those things all raise blood pressure. Evolutionarily, it's preparing the organism to flee or to fight, the fight or flight response. And the white coat syndrome is the phenomenon of a person only having elevated blood pressure in the doctor's office because they're nervous, whereas at home they don't have high blood pressure. So blood pressure is certainly a psychosomatic symptom like migraines and peptic ulcer disease and irritable bowel syndrome and even urticaria rashes. Stress and stress hormones and neurotransmitters like norepinephrine have a direct effect on a person's blood pressure and pulse and other cardiovascular parameters. So certainly if you are having those symptoms and you measure your blood pressure, you're likely to see an elevation. But the reason that individuals go into kidney failure and end up on dialysis or go blind or have any number of health complications because of high blood pressure is because hypertension, elevated blood pressure, is essentially an asymptomatic condition. Unless you're in a hypertensive crisis, unless your blood pressure is so elevated that you could stroke out any minute or burst an aneurysm or have a heart attack, you're not going to feel that elevated blood pressure. By the time you have chest pain and a headache and nausea from elevated blood pressure, that's a hypertensive crisis. That's malignant hypertension, and it's life-threatening. The vast majority of individuals who are walking around with blood pressures as high as 160 over 100 feel nothing in terms of the elevated pressure itself. They may be under a lot of stress, they may have frequent headaches, they may have symptoms that are related to their stress, but the pressure itself, in terms of millimeters of mercury, does not correlate with those symptoms of headache, chest pain, nausea that indicate pressure that is dangerously, potentially fatally elevated. And so this is why people who don't go to the doctor for well checks, who feel fine, often will go decades with elevated blood pressure and ultimately end up on dialysis because it is a silent killer. And as common as it is, people really should be monitoring on a regular basis. Anyone in their 30s should be going to see their primary care physician or gynecologist at least every 6 months to a year Women, of course, need annual pap smears and breast exams, and the older you get, the more frequently you should go. But if you're only getting your blood pressure checked twice a year, that's insufficient, in my opinion. Blood pressure cuffs are widely available. They're very accurate, $30, $40, and you can get it delivered. Omron is the best brand. They have an entire series from high-tech gadgets that Bluetooth with your smartphone to more simple devices. Actually, have my device right here. I check my blood pressure on a regular basis, and I recommend to all of my patients to whom I prescribe stimulant medications or other medications that increase norepinephrine to monitor their blood pressure on a regular basis. And the best measurement is going to be random measurements. I like to recommend first thing in the morning, even keeping it at your bedstand so that it's literally the first thing you do, and then an hour after taking a medication like Adderall or Strattera or Wellbutrin. Again, in most cases, there's no definitive cause. There are contributing factors, such as how much salt is in your diet, and if you're overweight, and whether or not you're a smoker, and medications, particularly medications that cause fluid retention or vasoconstriction. If I'm prescribing a medication that is inducing this side effect, then it's my responsibility to monitor that. And one of the few disadvantages of the telemedicine practice model is that patients are not coming into an office, they're not being attended by a nurse, and I'm not measuring their vital signs. And I cannot responsibly prescribe certain medications, particularly stimulants, Ritalin and Adderall particularly, and ignore the fact that that person's resting pulse and blood pressure will elevate. They won't necessarily develop hypertension, but in all likelihood, they are going to have some elevation, and so I have to monitor that. And I do require it of my patients. I do ask them to provide me a log, which shows the pressure differentials, and we can go from there. We don't usually have to abandon treatment altogether, but there are antidotes. And so if I'm inducing hypertension by prescribing a noradrenergic agent, then I can prescribe a beta blocker to offset that side effect, which will help with other side effects potentially as well, like sweating and tremors and other signs of too much norepinephrine. For the majority of my medical career, anything under 130/90 was considered acceptable, but the American Cardiology Association recently has revised that standard, and they are now recommending that all patients keep their blood pressure under 120/80 to avoid long-term complications such as blindness, renal failure, erectile dysfunction, and vascular dementia, to name just a few conditions. And there are different ways to lower blood pressure. There are different reasons why blood pressure is elevated. Many factors, hormonal factors and dietetic factors, as well as lifestyle factors, smoking and exercise and alcohol and medications, including over-the-counter medications, stress levels, and anger management. But my main message is you don't know if your blood pressure is elevated or even well controlled if you've already been diagnosed and you happen to be taking an antihypertensive medication unless you measure your blood pressure. That's the only way you're going to know. And it's been my impression that most people that have diagnosed and certainly well controlled hypertension are on more than one agent or are on a combination agent, one medicine that has more than one mechanism of action. There are very few psychotropic medications that actually induce hypertension, and in the majority of cases, people do not get hypertension from the medications that I'm prescribing, but it is a distinct possibility, and it would be negligent, it would be beneath the standard of practice, essentially malpractice, to overlook such a simple and straightforward and well-known phenomenon as elevated blood pressure due to medications.